Moin, and I'm going to be talking about a very rare occurrence after trauma that is called iridodialysis. Here you can see in this patient that we've got this area of redness over here on retroillumination, and this is the area where the iris has actually split from the root of the iris. If somebody gets trauma, and with trauma usually what will happen is the eyeball will tend to change its shape, and it gets vertically elongated like this because it comes because of trauma. When there's impact, it sort of changes shape vertically, and obviously when it changes shape vertically, the iris is going to detach from the root over here, and this produces this iridodialysis, which typically you would see. So if somebody would punch your eye, so the eye would be a ball, so it becomes vertically elongated, and it produces this iridodialysis. And it's important that at this time you can also get a retinal detachment. And when the iris detaches from that area, it can produce bleeding into the anterior chamber, and you can end up with a hyphema over here as well in these cases. So typically, if you have a hyphema, then you need to look for patients with the iridodialysis. And the other thing that can happen is, because you're stretching everything over here, the zonules also get stretched over here. So you can get subluxation of the lens, you can get tremulousness of the lens because of that, and even vitreous can come out through that area. So what does it look like on the slit lamp examination? Just let's go through the video, and you can see what has happened is the iris is becomes slightly D-shaped over here in this area because of this. Instead of going this, it becomes more straightened over here on the nasal side where the iridodialysis, and with this area over here, there's a bit of a cortical cataract over here in this patient as well. So it's very important to carefully look at these patients of iridodialysis. And what is the patient's view when he's seeing through this iridodialysis? He will see uniocular diplopia. Diplopia, if he covers one eye, and in the affected eye, he will see two shades, two pictures, because one is coming through the lens and the pupil, and the other will come through the aphakic area, which has got a different refractive error compared to this area. So the patient complains of diplopia, he can get glare because of that, and that is one thing. But the other thing, the complication you can get is angle recession. So always check for intraocular pressure in patients with iridodialysis. Dilate the pupil, or even undilated, look at the retina, try to look for a retinal dialysis in that area, or you look for a retinal break in that area. That's what I'm trying to look in the slit lamp examination, and I found a mild vitreous hemorrhage and inferior commotio retinae in that patient as well. So how can you treat this area of iridodialysis? Well, you can go in and you can suture the iris to the limbus over here, and this area and this area, and those typically are called the famous mechanical sutures, which can resolve this. And if the patient complains of diplopia, you can solve this problem for him. So if you like the video, please do subscribe to us and click the like channel. Thank you very much for watching. We'll be back.